Hi, welcome to the PANDAS Physician Network's interview, PANDAS and PANS, a 25th anniversary interview with Dr. Susan Swedo. I'm Susan Boaz, Executive Director of the PANDAS Physician Network. PPN is a nonprofit organization that provides PANS and PANDAS resources to clinicians while supporting research initiatives. Our vision is that PANDAS and PANS will become easily diagnosed and treated with accessible therapies that dramatically reduce suffering and lead to a cure for those patients. 2023 marks the 25th anniversary of the landmark paper, Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections, a clinical description of the first 50 cases. In that paper, PANDAS was first described by Dr. Susan Swedo and her colleagues at the National Institute of Mental Health. This set into motion a new way of looking at mental illness and the connection between psychiatric symptoms and infectious triggers. Since then, hundreds of papers have been published about neuroinflammatory brain disorders. Leading universities such as Stanford, Columbia, and Yale are all actively doing research. There are multidisciplinary clinics dedicated to the diagnosing and treating of PANDAS and PANS, and thousands of lives have been changed for the better. Our guest, Dr. Susan Swedo, is the lead author of that pivotal paper. Here we are 25 years later. She is continuing to advocate for those suffering from PANDAS and PANS and educating the medical community about how to heal these children. Dr. Swedo is internationally recognized for her clinical research on post-infectious autoimmune disorders. She has authored over 100 research publications and is the scientist emeritus at the National Institute of Health and the chief science officer at the PANDAS Physician Network. Welcome, Dr. Swedo. We are so honored to have you here today.
Oh, it's such a pleasure. Such a pleasure.
I want to say that over the last, I would say 15 years, I've gotten to know you personally, and I always think it's important to really just say a sincere thank you for everything that you've done, both for our kids and for others that are suffering from post-inflammatory infectious diseases that impact their brain in neuropsychiatric ways. And I'm just deeply grateful.
Well, and I've been grateful to be able to work with such amazing families, and the kids are just such heroes of this disease. And it's kind of humbling to look back on 25 years, actually 35, if you think about when we first started the research, and recognize how very far we've come. We still, unfortunately, have a ways to go, but we've made
good progress. Believe it's been 25 years?
No. No, except when I look at pictures of when I was presenting back then versus today, it's clearly time has not stood still.
Same for all of us. Well, I'm wondering if you could tell us just a little bit about how you made the connection between initially strep and the onset of psychiatric symptoms.
So it wasn't me at all, and I am always embarrassed and extremely humbled to get any credit for this. Credit goes to Dr. Judy Rappaport, who was the head of child psychiatry branch at the NIMH, where I was a fellow. Judy was going through all of the basal ganglia diseases because she knew there was a connection between basal ganglia dysfunction and obsessive compulsive symptoms. And so we looked at Sagawa's dystonia and Huntington's and all these other things and found, yes, there was a connection, but the strongest one was actually with Sydenham chorea. And Sydenham is known to be a post-strep neuropsychiatric illness. It follows a strep infection reliably by about 3 weeks. And as early as 1926, there were these gorgeous reports in JAMA and other journals about children with Sydenham chorea who had all kinds of psychiatric symptoms. And to those of us in Dr. Rappaport's branch, the most interesting was obsessive compulsive disorder. So she had said, Sue, you're a pediatrician, and therefore didn't know anything about psychiatry. You can look for strep. And we started looking for strep in our kids, and knew that would not be very successful because the children coming to us had already been sick for at least a year, usually 2 years. But what was very successful was looking at a group of children with Sydenham chorea and discovering that 2/3 of them had the abrupt onset of obsessions and compulsions, anxiety. And now when we look back on it, those records also show that they had the sleep problems, the urinary frequency, and all the other symptoms we think about with PANS. And those symptoms started 2 to 4 weeks before their chorea started. So it wasn't just that the chorea was making them anxious, that they couldn't move or pick up a cup. It was actually independent of that.
They were happening in parallel.
Absolutely, absolutely. And importantly for the model, the psychiatric symptoms preceded the neurologic symptoms by about 2 weeks.
That's fascinating. And from what I understand, PANDAS was not the initial name of the disorder?
No, we first called it anti-neuronal antibody-mediated neuropsychiatric disorders of childhood, which was a long tongue twister, but we actually abandoned that for 2 reasons. And the most important of it was the fact that we couldn't be 100% sure it was anti-neuronal antibodies that were causing this disorder. We had beautiful evidence by the effectiveness of plasmapheresis, by some actually never published data showing that if you applied our kids' serum onto a juvenile monkey brain, that it lit up the caudate and the putamen and areas that now are being found by Dr. Pittenger at Yale and Dr. Agayu and his team at Columbia. But it was right in the basal ganglia where Dr. Rappaport had predicted it. So we put out a contest for the research assistants to come up with a more tractable name, and one of them had been to the National Zoo, so she came up with PANDAS for pediatric autoimmune neuropsychiatric disorder associated with strep. And we debated so long, associated with. We didn't want to say caused by, because we couldn't prove that yet. Didn't want to say even related to, just associated with as in an epidemiologic standpoint. And so to us, it was quite surprising, shocking that PANDAS was considered to be as controversial as it was, because we thought we'd been very careful to be just very conservative in our claims.
It must be incredibly affirming now to look at the research that's happening around the country and that it's really validating those initial premises of how this disease can occur.
Yes, yes, it's beyond exciting. I just had the opportunity to watch the webinar, and if you guys haven't seen it, go immediately to that link on the PANDAS Physicians Network and see the webinar with Dr. Agayu, where he explains his latest research and just pulls together so beautifully the role of the infection, the role of the cross-reactive antibodies, and then very importantly, and what we didn't dare suspect at the time, actual involvement of the T cells and neuroinflammation. And I think we're this close, maybe this close, to finding the biomarker that really can identify children during illness and serve sort of the equivalent of a strep culture for a strep throat. You want something that says, yes, this child's symptoms are definitively related to PANDAS and you should treat this way.
I love that you immediately dive back into the individuals around the country who are doing this research and that you give so much credit to everyone that has been a part of this journey. And yet I feel like it's important to say to you that if we had done this retrospective 15 years ago, we'd really be talking much more about controversy and what research needed to happen. And we're at this incredibly exciting moment where the research is happening and that we are on the verge of a biomarker and that it is affirming the work that you did so many years ago. And I just think that's really exciting. And I want to pause for a moment and recognize that I think we're at a pivotal moment. I often think that our children are going to help so many people with psychiatric illnesses in the future. And I'm excited about this place that we stand in right now.
Yeah, I don't think PANDAS was ever given credit for it. But a lot of the discoveries that happened with COVID and the fact that COVID is recognized as a post-infectious neuropsychiatric disorder really can be credited to the work, not just of our team, but so many others around the world on PANDAS, PANS, other infection-triggered encephalitis of childhood. And we've known about them for decades. I think it's time that our patients can get the treatment that goes along with the scientific knowledge we have at this point in time.
Tell me a little bit more about that, because COVID is accepted as an illness that causes neural inflammation and psychiatric symptoms. Can you just tell me a little bit more about that?
Yeah, well, COVID, I think by sheer numbers, COVID rapidly was accepted as an illness that can cause neuroinflammation as one of its sequelae. And as part of that neuroinflammation, psychiatric symptoms occur. So that work was piggybacked on to work of Dalmo and others with NMDA encephalitis, but all of the encephalitides have at their root an infection that then triggers an abnormal immune response that results in neuroinflammation. And PANS and PANDAS have that much research and more. So it's really time for the field to catch up to what we already know, and that is that this is a disorder that can be recognized, diagnosed, and treated, and it's time for the American Academy of Pediatrics to come on board.
Talk to me a little bit more about your thoughts about COVID and neuroinflammation.
So I would say that COVID represents an opportunity of volume. Just the sheer volume of patients made it so clear that it could not be denied by anybody that the SARS-CoV-2 virus was capable of producing post-infectious sequelae. Everything from loss of smell and taste to frank psychiatric symptoms. PANDAS has more than 25 years of clinical and research support that's equally impactful. And I think it's time that the clinicians in the field catches up to what we know to be true, and that is that children with post-infectious encephalitis, whether it presents as COVID or presents as PANS, deserve recognition and treatment.
I really appreciate that. It's been interesting to watch adults with COVID and neuropsychiatric symptoms receive recognition and care, and yet understand the struggle that parents have had over the decades to have their children who are having the same struggle from a different illness be recognized and treated. And children suffer for decades and lose those essential years of learning if they're not treated. So I really appreciate that connection that you're drawing there.
Yeah, I think it's just we need to be a little bit humble about this and recognize that there's nothing new under the sun. PANDAS, Sydenham chorea were described in the 1800s, and it's fine to come back to them. We have a new virus that showed us a new way to think about things, and we can learn from that.
How can the AAP help us with that?
I think the AAP urgently needs to recognize these illnesses as real. It's been 5 years since they said that they would take a serious look at this. They did the literature review. We provided them with hundreds of articles documenting the clinical picture, the ability for clinicians all over the world to make a diagnosis. The group in Italy who showed so beautifully that just adequate antibiotic treatment early on can prevent symptoms, can actually, abort this illness. And you have a child who goes from extremely ill to well, just with adequate treatment of the infection, the inciting infection. And then you have, oh my goodness, there's so much, my brain is exploding. Just everything.
It's a really big question, right?
It is a huge question. The AAP has been on the wrong side of this question for a long time, and they need to make that right.
I hear you loud and clear. I think the American Academy of Pediatrics, I like that you said they urgently need to recognize PANDAS and PANS, because pediatricians need their support to recognize and treat these serious illnesses. The American Academy of Pediatrics is a very important organization, and their support for this illness, I think, will change the lives of children into their adulthood for decades to come. So it's a very important issue, and I appreciate your speaking on it. All right, from there, I want to take it back a little bit to, what was in your mind as you and Dr. Rappaport were really thinking through this initial illness. Are there other diseases that have followed similar evolutionary arcs of discovery and hesitation by members of the scientific community, and then ultimately recognition?
Yes, many. And I think we're ahead of some and behind others. So I think the very best example is ulcer disease relation to Helicobacter. I think that the issue is the same. And as I look back, as you mentioned earlier, if we would have done this 10 years ago, or sort of 2018, when the competing papers were published on whether it was PANS or CANS, and then the AAP, sort of jumped in the fray. I think the controversy really reached a peak, and I had looked at it as there was this wonderful decade and a half of discovery from 88 when we first started the experiments in Sydenham, Korea, to 98 when we published this paper, and then all the way to 2004 when the first we're not sure this really exists papers were published. And there was a he said, she said debate, literally he said, she said, because it was 3 female authors on the PANS side and 2 male authors on the PANS doesn't exist side, published in pediatrics. And so that then led us to a decade of controversy. And now we're back on this wonderful, hopefully more than a decade of discovery, because I think PANDAS has the potential, and PANS, to really revolutionize the way we think about all mental illness. It's very affirming to know that obsessive compulsive disorder, whether you can identify a strep trigger, a mycoplasma, it fits PANDAS criteria or it doesn't, it's still real. It's still brain-based. It's still in, there's a dysfunction of the brain. And when we use behavior therapy to treat OCD, it has exactly the same effects on brain metabolism as when we use medications. So the fact that you can use a behavioral modification does not in any way take away from the biology of this disorder.
It's interesting, isn't it? Because I think something you can see that's physical is always more readily accepted than something that is occurring in the brain, right? If it's a invisible illness, I think we hear this struggle in many different communities, especially in the autoimmune community. Invisible illnesses, such as something that's impacting the brain and thus behavior, is often either minimized or judged. And yet you've stayed so passionate to this disorder. Is part of that because you've seen the severity of the OCD in how it's impacted children and their families' lives?
Absolutely. The fact that this is a mental battle that they're struggling with. And the analogies I think we work best are those patients who have a bad stroke and they can't speak. They look perfectly healthy to you until you try to communicate with them, or maybe they have a receptive aphasia, so they can't even understand what you're saying to them. And again, appearances can be deceiving. And so one of the other problems with OCD is that it's been described as a disorder of rational irrationality, or the children and the patients know their symptoms don't make sense. And so they try to hide them. And our kids are trying their best to hide this and act like everything's normal, because there's this horrible fear that I have just gone crazy and my life is never going to be the same.
You also touched on something that I found interesting. I wasn't planning on asking you about this, Sue, but you talked a little bit about the challenges. What I heard was you talked about being the challenges of a woman in research and in a position of discovering something that is unique to the field. And given that this is a retrospective, both about the path of PANDAS and PANS and also about your journey on that, I wonder if you could touch on that a little bit more.
Well, yeah. I've been trying to let that one go since into the modern age. I think Dr. Sandra Arab probably said it best. She listened to the whole story at a meeting and then looked at the videos where we sort of separated children and made you guess whether they had choreiform movements or no movements at all. And she's not a neurologist, and she got 100% of them right. She goes, "That's really not that hard." What's the issue here? I said, "I don't know. Maybe it was, in fact, I'm a pediatrician coming up against much more erudite psychiatrists and neurologists, and they know the brain better than I do. I would be the first to admit that. I think I know strep better than they do, but that's a different point." There was some definite sort of chauvinism at play here. I think there was also the difficulty of any kind of paradigm shift. I know that They tried to equate this to Semmelweis and his attempts to get the OB-GYNs to clean their hands when they went from the nasty cadavers to the delivering babies to try and decrease infection, and how long that took to take action. But I think it's also really been impacted by the stigma against mental illness, and just the fact that as much as we try to pretend we're living in 2023, we have some very dark ages attitudes towards mental illness. And I think that once that changes, then things like PANS PANDAS will be much better accepted.
I think that's happening across the field of mental health, right? That we're seeing both a revolution in acceptance, but also an awareness that we have a very long way to go just simply on eliminating stigma about mental health. And so if you're trying to do research in a field where the stigma is high, I know there are some real challenges there. I wonder what you would say about what needs to be accomplished going forward in this field.
As what I think needs to happen now is massive awareness on the part of pediatricians, emergency room physicians, everybody else. And we asked in the original paper, so 25 years ago, and I've asked every time I present or write since, for people to do a throat culture when the child presents with an acute personality change, with an acute onset of worries, an acute, even urinary tract infections. Work from Picacchiero and Marie Murphy in 2002 showed that 8 out of the 12 children who ultimately had met criteria for PANDAS actually presented with frequency of urination, and they worked them up for urinary tract infection. So many of the PANS symptoms are going to be found in children who maybe don't have obsessive compulsive disorder and wouldn't fully meet PANS criteria. But what we know from the Picacchiero work was you find the strep, you treat it, the symptoms go away. And that to me is just such a non-brainer. That's a pediatrician's approach to illness, right? Child's crying and pulling at their ear, you find they've got otitis media, you treat it with antibiotics, they're all better. We could do the same thing, except instead of it pulling at their ear, they're having obsessions and compulsions and anxiety and panic attacks and all the rest. Let's treat it and see if it works.
It's not to minimize at all that there are very complicated cases of PANDAS and PANS. And
Absolutely.
it can be very difficult, but there is certainly a subset of children in which the answer is relatively simple, which is severe personality change, check for strep or other infectious illness in the child, and treat.
Yeah, and treat the infection.
Early detection is very key to this illness. And so that is that first step, right? If we can take care of 70% of it by sudden onset of a personality change equals check for infection.
That would be so awesome. That would actually be the legacy I would like to leave. If I could choose anything in the world, that is what it would be. And I think that's what hurts my heart the most about the American Academy of Pediatrics Red Book, because they specifically say, unless there are signs of acute pharyngitis, do not check for strep. What is the harm, right? As physicians, we have taken an oath to first do no harm. I do no harm by using a little cotton swab to take a swab of a child's throat. I potentially do a lot of harm by refusing to take that swab and not recognizing they have strep, or hearing the cough and saying, maybe they've got mycoplasma, other infections, and then treating.
So if you had a change, if your legacy is to leave behind that change in the Red Book, Sue, what would it read?
It would read, much as you just said, in any child with an unusually abrupt onset of neurologic or psychiatric or behavioral symptoms or personality change, check for infection. And if found, treat it.
Yes, I do like that last step. If found, treat it. I think
yeah, exactly. Yeah, don't just look. Go ahead and treat.
Don't just look. Actually, treat it. You know.
And I think it's really important that people hear me say, look for the infection, and when you find it, treat it. Sorry, I'm pounding on my hand because I don't have a soapbox nearby. But,
that's great. Thank you, and I really appreciate that. That is the one thing that you would call out as your legacy. And again, it's so important to say there are more complicated cases, but if we
Yes.
could treat those early onset by simply having awareness at the pediatrician's office, what a miracle that would be for so many children and their parents.
Yes.
Okay, well, so I have other questions for you. I'm really curious about what you would say to families who have gone through this struggle in the last 25 years, how you would talk to those who have been in this struggle with you.
I'm sorry, getting emotional with that question because so many are flooding into my mind right now. I can tell them and you that I do feel for what you guys have been through, and I'm glad that we've at least made the progress that we have. And maybe it's too late for your child because they had to suffer for 5 years when they could have been much more rapidly treated. But maybe they're part of the lucky group that actually did get treatment. And that's the thing that maybe is not a source of anything other than just being very grateful it's finally happening. And that is that I'm hearing from more and more and more families who do get that early recognition. Doctors who say, oh yeah, I had a kid come in. I knew the family for, this was their 5th child and everybody was so healthy. And then this kid came in and was acting really squirrely and did a throat culture and it was positive. So I treated him and it was all gone. Those kind of stories are much more common. And I think that that's the really encouraging news. The other piece that we always just have to hold in our hearts is the fact that PANS is just one kind of obsessive compulsive disorder. And in that same 25 years that we've been working to try and figure out what PANDAS is, what causes it, how can we recognize it, how can we treat it, equally impressive and impactful progress has been made in non-PANDAS OCD. And when I go to the IOCDF meetings or read the most recent papers and see the numbers of children as well as adults who can receive adequate and appropriate treatment, it's really very encouraging. And I think maybe the message for OCD as a whole is the same, that is really important to recognize it and make that diagnosis early and relieve that child. I see children, so I'm not going to talk about the adults, but the child from suffering, because we still have this horrible lag between when their symptoms start, when they start some kind of treatment, and then when they finally get appropriate treatment for their OCD. Let's make that short. Let's treat it like a pediatric illness. Let's treat it like otitis media. And when the obsessions start, get them into a behavior therapist. If that's not enough, add some medication and give them the relief that they deserve.
I'm so grateful to hear you talk about OCD as a whole. So as you know, I sit on the board of the International OCD Foundation, as well as on the board of the PANDAS Physician Network. And there's so much, even within those two fields, there's so many challenges in diagnosing the children correctly, right? What is the first vein of care? And I know the National Institute of Health talks a lot about this right now as well, right? How do we know which patient will respond to the right type of care in the best way? If I were to say what I think is most needed in the field going forward, or actually I'll ask you that, as we think about that diagnostic difference between someone who is suffering from a slower onset of OCD and someone who has rapid onset, we'll just differentiate in that way from infection or inflammation. What is needed in the field next to help us best identify those children?
It would be great to have a biomarker that can distinguish the two. It would be lovely to be able to have clinicians sort of have, you mentioned at the start of this talk today that it's hard when you can't see it, right? And so if we had something very objective, something concrete that would make that distinction, families are now being accused of rewriting their history so they can put the child in the PANDAS pocket instead of the non-PANDAS pocket of OCD. And I don't think that happens as often as the criticism would suggest, but I think it is a natural inclination to want a more tangible explanation for why these symptoms are happening.
If we really looked forward 50 years, Sue, to the history books, what do you think they'll say at that time about the connection between infections and neuropsychiatric symptoms?
I think they'll say that a small group rediscovered the connection that had been well established before the schism. And it was probably that Freud-Charcot division, right, that took psychiatry and neurology and split the brain. Like somehow it magically decides that I'm going to go to this practitioner instead of that one. And they will probably laugh at us that it took us as long as it did to make it happen, but hopefully they will have a beautiful ending to the story. And I think that's not going to take more than the next 2-3 years, would be my guess, as fast as the research is going, that we're going to have the biomarkers.
I like that I went forward 50 years and you're so confident. I think that's really, if I had had this conversation with you again 10 years ago, I don't think you would have said that. To hear you say now, in 2 to 3 years, we will understand the connection between infection and neuropsychiatric disorders. And we will look back at the past in that moment as simply the past. And we'll be able to start treating and diagnosing those disorders. That's a pretty big statement from you. That's
a huge statement from me, isn't it? Because Susan and I know each other quite well, and she knows me to be pretty conservative about what I say.
Yes.
I had enough scientific training to never say never and always say always. So yes, I think the reason is because of the work being done by Jenny Frankovic at Stanford on the genetics. And I've already mentioned Dratan Agaliu and his team at Columbia on that strep animal model. And then Chris Pittenger's work on the anti-neuronal antibodies. There are actually now NIH-funded grants. And when I look at the field, I personally see that we already have all of the answers that we need. It really now is just translating the science into clinical care. And since I'm only a clinician, I've been trying to do that from the very beginning, kind of backwards. And now what we do is well-founded and well supported by the research literature. Just go to the PPN, and in probably 20 minutes, much less time than you would have to spend to listen to our interview today, you can figure out how to treat the child, how to recognize it, and then we can start taking care of what Susan thinks is 70% of the children, and they won't have to go on to more illness. That's not my quote, that's yours.
But it's interesting. It would be one of the questions that I would ask. What percentage of children, if caught at early onset, could we cure by simply diagnosing the illness and treating it? That's one of the questions I would challenge the field to answer.
I think that's a great question to challenge the field with.
With that answer, it would be much easier to reach out to say, this is where initial diagnosis has to happen. Now, that's up to the researchers to figure out, right? If it's only 5%, well, then we should be concentrating on those more severe illness and more and higher levels of care, right? But if it is 70% of children who have sudden onset of neuropsychiatric symptoms that could simply be cured by checking for infection and treating it, that's pretty exciting. So that would be my challenge as executive director of PPN out to our researchers to figure out that question. Sue, what's your challenge out to our researchers to answer in the next few years?
I would say that I would really love to see a meaningful state biomarker. Several people are working on trait, who's the susceptible individual, and I know that that's an important step to get to state, but I'm an impatient person, and I would just love to have the equivalent of a rapid strep test for PANDAS.
Yeah, so we get the two things together, right? Your biomarker combined with a research study to say, if you use that biomarker early, what percentage of kids can you treat, diagnose, and cure at that early stage? And it will be interesting to see where the field takes us with some of those questions.
And you know what, Susan? I would be absolutely happy if even without that, we get to the point that we don't ever have to talk about PANDAS, because it just becomes commonplace that, as we talked about earlier, when a child presents with an acute onset of personality change, odd behaviors, extreme anxiety or even mild anxiety, especially separation anxiety, that a throat culture gets done, a mycoplasma workup gets done. You look for infection, and when the infection's there, you treat it. And if we never know that it was 80% of all pandas, that's okay, because we will have eliminated it and it will be gone.
I would be okay with that as well, Sue.
I think so.
Are there any other things you'd like to say to us in closing, Sue?
No, I just want to thank the Pandas Physicians Network and actually thank the parents who are looking. Parents have been really the key to all of this from the very beginning, because it was a mom who first identified pandas. So I've said it in many of my lectures before, but we're eternally grateful to her and to her 3 boys, because she was able to recognize the pattern of every time her oldest son's tics got worse. She knew she needed to bring home a throat culture and swab his throat, because within a day or 2, he'd end up with a symptomatic sore throat and she'd have to miss work. So she obviated that by just doing the throat culture on the basis of his tics. So when her youngest son started having abnormal movements, she immediately thought strep. And that was the connection that really sort of made the whole pandas research possible.
I love that you're taking it back to the parents, because I think that is the new paradigm in disease discovery, is the connection between the patient and the researcher, and that has become a much more fluid system than it was in prior years. So I would echo that appreciation for the parents and the many parent groups who have supported this field all along, with raising money for research, for raising awareness about the illness, for asking for help for their children. And really, the Pandas Physician Network is simply here to support all of you in the field in the work that you're doing. Sue, Dr. Swedo more appropriately, but Sue.
Yes.
I hope you know how many lives you've impacted and how many you've saved. On behalf of all of us at the Pandas Physician Network, the clinicians, the researchers, the families, the parent groups, thank you.
Thank you.